Welcome to the Tarrant County Medical Minute podcast.
Hi, my name is Dr. Omar Salat. I'm the 2024 Tarrant County Medical Society president. Today I'm joined by our EVP of the Medical Society, Brian Swift, and our special guest to discuss public health is Kenton Murthy. Dr. Murthy is the Assistant Medical Director and Deputy Health Authority of Tarrant County. Dr. Murthy, please give us a little bit of information about yourself, your training, your path to doing what you're doing.
Well, first of all, thanks for having me. This is exciting to be here.
Absolutely.
I originally grew up in San Diego, but I've been living in Tarrant County now for almost 20 years. I went to medical school, graduate school, School of Public Health, all at the University of North Texas Health Science Center.
So one of our own.
Yeah. Just not born, just bred. But so I've been here, went to all my schooling here. Afterwards, I trained at Rutgers Robert Wood Johnson in New Jersey, where I did a dual kind of residency in family medicine and health management policy, kind of expanding on the research I did in my School of Public Health, getting my public health master's degree. Afterwards, I moved back to Fort Worth. I started a practice for Baylor Scott & White in Burleson, did inpatient and outpatient for about almost 3 years. So then the opportunity for an assistant medical director position opened up at the health department, and I left the private practice world and came to the health department because I've always wanted to work in public health, and I've been here for almost 7 years now.
Okay.
Awesome.
Yeah. So, for those less familiar, describe public health.
Yeah.
What does that mean?
What does that mean? Well, I like to think of, from a family medicine perspective, I like to think of public health as a preventative medicine organization. And essentially that's what we are. We do food inspections, we do restaurant inspections, food truck inspections, we do septic and pool inspections, and all that is to prevent some sort of disease process or preventable deaths. We have vaccines, we have a robust vaccination clinic, travel health. We have our epidemiology group and our surveillance group that look to test illnesses and as well as do intakes and investigations on illnesses. And again, it's all to prevent an outbreak of some sort of acute illness. But we also address chronic disease. So we look at hypertension, hyperlipidemia, diabetes in the area. We have groups and nurses that go out to the community to educate how to reduce their diabetes risk or hypertension risk. We also try to connect people to care if they don't have access to care. We may not see them at the health department, but we'll able to either try to get them access to an insurance to get them insured, or at least get them to an FQHC or some sort of free population kind of family practice that they could be seen.
I think that's good you point that out, because I think there's a misconception with our younger medical students, physicians in training, that public health deals with, viral infections, bacterial infections. You're talking about even hypertension, other medical comorbidities. You guys are involved literally with everything.
Right. And so, we always think of public health as just kind of acute viral illnesses, bacterial illnesses, but that's not the only thing we do. Yes, we're experts at that. That's our subject matter experts in things like sexually transmitted diseases, HIV, tuberculosis, vaccine preventable illnesses, but those chronic diseases that affect our community, especially in those in the underserved, under-resourced areas, those are the places that we try to reach out to as well, because they require and need the education.
Okay.
And Kenton's always been great. I mean, you jumped right in. I mean, we hit it off, 7 years ago, right? And it's like, get right to the party. But, it was interesting. Just the other day, I didn't know, right? We had a person call in on the phone, and they're like, look, my kid, we lost their vaccination records. What do we do? Do we start over? How do we handle that? And I picked up the phone, and a lot of people, right, don't even have that basic information.
Right.
So why don't you talk a little bit about, again, what the conversation was, right? The parent was panicking.
Yeah. And so, we have a philosophy at Health Department where we have no closed doors. So we may not be able to give direct care or access to a person or a patient, but we at least will work on trying to connect them to someone else. So in this particular case, it was someone who didn't have lost their child's vaccine record. And if if they came and saw us and we provided those vaccines, certainly it's in our EMR. We have those records. But the state has a state database if the parent has consented for their child's immunization record to be on there, called IMTRAC. And so we have access to IMTRAC, and we can easily get them their vaccine records if they require it or if they need it.
Right.
So it's great for schools, for them to return back to schools. Mm-hmm.
Right, and especially this time of year, right?
Yeah.
The person, they were panicking. They're not going to let me attend school, and didn't want her child to miss any school.
Yep.
So need those vaccinations.
And we were able to help her, which was fantastic, because we don't want our kids to miss school, especially when over vaccines. We can either get them their records to show that they have the vaccines, or if not, we can easily get them the school-based vaccines that they require.
Right.
So what are some resources, services that your department offers, clinics here locally, private practice clinics or other clinics, primary care clinics? How do they connect with y'all? What can they reach out to y'all for? What do you commonly hear from everybody?
Yeah, so we do have clinics. So we're not only just a preventive medicine kind of organization where we go out and screen and do surveillance, but we do have clinics in our health department. We have a HIV continuity clinic, so it's a Ryan White funded clinic. And just for a brief background, Ryan White is a over $2 billion federally grant funded program that gives money to underserved HIV clinics. So we are at the health department one of 4 outpatient Ryan White funded clinics. So it's a big deal to be a Ryan White funded clinic. So we have an HIV clinic. We have an acute STD clinic where we take care of any sexually transmitted diseases. We have a state mandated tuberculosis clinic. In fact, that's one of our, there is state law that states what a health department must have if you have it, and a TB clinic, a TB elimination clinic is one of those state mandated laws, so we have one of those. We also have a refugee services clinic where we see acute refugees that have come from various countries, and we assess them here before they go to either JPS or another private office. And then we have 5 immunization clinics throughout the county, brick and mortar, and then we have our travel health clinics. And then our newest addition during COVID was our mobile clinic, where we were able to now take a truck that we have to go around the community to service. So we have these kind of brick and mortar clinics. I would say what we get the most amount of calls are, for the most common, is usually syphilis or some sort of acute illness that a physician may see that they're unfamiliar with. Syphilis being the most common, because we do unfortunately have a increasing syphilis rate here in Tarrant County, as we do across the United States. We were doing a great job pre-COVID, where both HIV and syphilis rates were going down, but since COVID, those rates have been going up. And unfortunately, as we see our syphilis rates go up, you have an increased risk of, say, congenital syphilis. So sometimes I will get calls from obstetricians asking if they want to help analyze a patient who may fear they have syphilis. And so oftentimes we'll have them come over to our clinic so we can evaluate them ourselves, and if necessary, get them ready for treatment. So those are the most common calls. And then sometimes we'll get calls for dog bites, rabies, if they need help with getting a rabies vaccine, or where do they go to get those rabies shots. We'll get calls if they, during kind of this measles scare that's going across the United States, we may get calls from ER doctors saying, hey, I think we see measles, we're not sure. And they're during, before my time when I started the health department, but during the Ebola scare, our doctors' offices or our doctors were getting inundated with potential Ebola calls. They weren't sure if they were seeing that, so we were trying to guide them. So the good news is, not just me, but my colleague, Dr. Catherine Colquitt, who is an infectious disease doctor, has been with the health department for about 16 years now. We give out our phone numbers, our cell phone numbers, so any doctor can call us if they have any question. We're always here to be available and ready to answer. And like I said, if we can't answer the question, we always try to get them connected to someone who may be able to.
Dr. Colquitt is... she's incredible. I met her when I was young in my practice, and oh my goodness, she is like one of the most amazing, caring physicians I've ever met. I mean, she's a legend here in Fort Worth. She's a legend here in Fort Worth.
She is. She was born and raised here. She went to med school at UT Southwestern. She's been practicing here for over 30 years. She is a force to be reckoned with. She knows everybody. Compassionate, yep.
Yeah.
She pretty much knows everyone here, and she will absolutely go above and beyond to make sure her patients are taken care of. And that's why she's excellent as our medical director, because she takes that care and that compassion and now expands it to a population health practice.
Yeah. Right.
Well, one of the things that, and again, being naive, right, about what public health does, when I came here, all I knew in the beginning was that we always had in our magazine, Dr. Colquitt, right, or someone from public health would write an article every week or every month.
Yep.
About something, right? Whether it was, like you say, bird flu, all right, vaccinations are coming up.
Yep.
So it was always this public health article. But I really got to see in practice how the two organizations can be so valuable to one another.
Absolutely.
And of course, that was during COVID.
Yeah.
And at least I observed, I mean, we did everything from contact tracing with you. You needed physicians. We were working together to supply some of our retired physicians to start that off. We were setting up immunization clinics. We worked with the private sector on that to get shots in arms.
Yeah.
The other thing we did was a huge PPE mobilization where we just handed out millions. We had, at one point in this building, 2 million masks that we were handing out. But one of the really, I think, key things that we did together was coordinate messaging. And so on the PR side, right, to get the best message, you'd ask us, all right, can we talk to a doc that works in this specialty or that specialty? And I thought that was just great how we teamed up and partnered on this issue because messaging was so key.
Absolutely. Yeah, I'll say if there is a silver lining with COVID, it was that when that pandemic hit, we all came together as a medical society, medical group. We, both public health, private sector, hospitals, medical society, community partners, we realized we couldn't do this alone. And public health didn't have the infrastructure at the time to handle a pandemic of this size and magnitude alone. So we brought everyone together, and everyone came together, really worked hard towards fighting this. And the medical society's involvement was invaluable, not only giving the resources and connection to other physicians who we needed their help, whether it was giving vaccines or doing our investigation and contact investigation for COVID, or even distributing, like you said, PPE. That was invaluable. And so what we've learned with this pandemic, that we really are one group, and we really need to work together to move towards that. I always, there's a story of public health, and I'll say it briefly about public health's origins. So public health really started, the origins of public health started in 1850, London, England. So if you go back to then, it was in the height of the Industrial Revolution for London. They were growing by millions and millions of people every year or every decade. And one of the kind of diseases they had that kind of caused a lot of deaths in the tens of thousands every year was cholera. Cholera is a bacteria that grows in unclean water. And during London, you can imagine 1850s, during the Industrial Revolution, they had unclean water, air pollution. They didn't have sanitary services. There was no septic tank or sewer system involved. So as you can imagine, kind of the disease especially amongst the amongst poverty and low socioeconomically affected individuals, you had all this death and dying disease. Well, this young physician by the name of Dr. John Snow, he was a pulmonologist at that time. He was determined to figure out what was the cause of this cholera outbreak. And so what he did is he kind of scanned vital statistics. He looked at death rates and birth rates. He then also went individually door to door to every house in London, asking them how many people have been afflicted with cholera, how many people die from cholera. And he took all this data, and these are techniques that weren't even developed. Public health didn't really exist back then. He decided to take all this data and put it on a map of London, England, a schematic map. And what he noticed was the concentration of the outbreak, the largest concentration centered around a single drinking water well. Wow. And he he assumed that maybe that was the cause of the cholera outbreak. So he went to local leaders and he showed them his map and he said, look, if you close this well, I promise you the outbreak will end. Took some convincing. They didn't believe him at first. Took some extra data, some more talking. They finally said, okay, we'll listen to you. And they closed that well. And within 2 weeks, the cholera outbreak had ended.
Wow.
And from that, the local leaders were so excited by just a little change causing such a big public health difference. They started cleaning up the air. They started cleaning up the water. The local leaders invested a lot of money to create an underground sewer system and to take away all that kind of sewer and matter out away from the water. They introduced garbage services. They really worked on cleaning up. And then in 10 years from doing that, London never had another cholera outbreak again. So I love this story because it encapsulates what public health is and what it does. But it shows that public health isn't an institution, but rather a collective of people from doctors, nurses, scientists, engineers, bricklayers, construction workers, teachers, religious leaders, government officials. They all come together to help solve a public health crisis. So I always like the story because it shows that we are public health. Public health isn't just an individual or group, but it's a collective organization. And I think COVID really shone that light that public health takes all of us to make a difference. And I think going forward, as we start working with our partners and really connecting with our community partners to either prepare for the next pandemic or prepare for anything that may come out that would affect our community, that is the kind of the story we have to, and the lessons we have to learn moving forward. That takes all of us to really work on working on improving the lives and health of our community.
So what do you see some of the challenges that lie ahead? You say, okay, maybe another, pandemic comes about, or what are some of the challenges you see that lie ahead of us?
I think one of the challenges that we all experience is our workforce. We have a depleted workforce. We have a tired workforce. We saw that with both our physicians and in the public health sector. They really worked 7 days a week, 24 hours a day for years, right? Trying to help get this pandemic controlled. So like other sectors, our health professionals and public health professionals burned out. And so we saw a lot of turnover. We're seeing a lot of turnover, even our current health department, people leaving the institution and moving on to other careers, other opportunities. Also, as the federal tax dollars and money kind of dry up from the end of the pandemic, right? As funding goes down, we have to now figure out how to do more with less. And so some of those challenges going forward are going to be, how do we support our infrastructure that we have built up over the last 4 or 5 years, and how do we continue to grow that, being very aware that it hopefully won't be for another decade or two that we'll see a pandemic, but being prepared. But I think the best way to do it is, one, educating and training our workforce. So we have those that are coming in brand new, working on that education, teaching them the lessons we learned with COVID, building it up, and then continuing the partnerships that we gained during COVID. I mean, just going back to the medical society, obviously we worked together even pre-COVID, but post-COVID, we became this family, right? This unit that worked together to stress education, to give out information, PPE, whatever we need to. We connected with all these partners, including the hospital groups, right? That's what makes Fort Worth, I think, one of the strongest areas, is because we have such a strong hospital system. The hospital system during COVID bent but never broke. And I thought that was what was amazing, because we had such dedicated professionals. We have our safety net hospital, our central hospital, JPS. We have Harris. We have Medical City, right? We have Cook Children's. We have all these powerhouses of hospital systems that are set up. And they took and they were able to help keep our patients healthy. And then with our medical society, our community partners, the health department, you had all these forces coming together to kind of continue that. Right. And I think we're going to, building on that in the future is what gives Tarrant County its strength and will allow us to kind of persevere in the future.
Right. And we're lucky in that, right? We like to sometimes throw darts at the things that are wrong. Yeah. But look at the resources that we have here, and you just pointed that out. Look at the partnerships, and moving forward, leverage now those partnerships to do even more. Of course, I think we've always had, but this has facilitated our relationship. And, you mentioned just a few minutes ago about nurses. Yeah. I know we have a program here. You just, last week, right? Week, Why don't you talk about that, right? School nurses.
It's fantastic. So we had we have a school nurse public health partnership along with the Medical Society where we bring in school nurses from across Tarrant County to educate them on any acute or chronic public and population health diseases and issues going on in the community. And also we talk about vaccines. How do we increase our vaccines to our kids and adults? How do we decrease vaccination preventable illness? Again, one downside that came from COVID is this kind of distrust of maybe the vaccine or the health system in some ways. And so we've been now combating that to really show that, one, they're important to do because getting vaccines, especially to prevent vaccine preventable illnesses, is vitally important. We've seen outbreaks in other states for measles, for example, as the vaccine rate for measles decrease. So educating the school nurses again. We took a little break during COVID where we didn't have those meetings, but now we're back on it. So having the school nurses meet here at the Medical Society has been fantastic resource for us to educate them again. And we also have something called the Immunization Coalition of Tarrant County. They're a nonprofit, private organization, but they collaborate with Public Health and the Medical Society. And this is how we help do our annual, what we call Shot Rush, which is our big back to school vaccine event for kids. So around August of every year, July and August, we just had one. We will open up mass vaccination sites in Tarrant County to get all the school age children vaccinated and ready to go for school. So one, there's no missed school days, and two, our kids stay healthy. And so we had a fantastic year. It's the most kids we've ever done. We did well over 8,000 children, vaccinated over 8,000 children this year, which is the most we've ever done, and got them all ready to go to school. And I will say the unique thing about Tarrant County, or maybe the best thing about Tarrant County, is some of the other challenges that maybe other counties and areas in Texas have, we don't have, because our community is very supportive of the public health system as well as our medical system. And I think having that support, we've been in the community for eons. They trust us, they know us, that they bring their kids to get vaccinated. And I think that's one of the best things about us.
In our alliance, of course, BY's Immunize program,
right.
that, they love. I mean, dedicated.
Yep.
You talk about dedicated to making sure that those clinic, right when they're giving out the shots, they're staffed.
Yep.
And so it's been really a proud thing for the alliance to be able to contribute
Absolutely.
to that.
Can't do it without you guys.
Right.
Yeah.
But
so, I know we're running short on time.
Yeah.
Are there any emerging public health threats that you see that might be coming down the road here?
I went, luckily, nothing that looks as like a pandemic coming down. But I will say what COVID, unfortunately, again, what did was people during COVID didn't have access to care, whether it was public health care or it was their private physician, hospital system, whatever it was. So what you're seeing as these kind of the years are going by is all of a sudden people are noticing an increase, an uptick in viruses and like even mosquito-borne viruses that we've never even seen. Mpox, for example. We're seeing, some meningitis outbreaks, measles outbreaks. So we're seeing this kind of increase in areas that we haven't before. And that's just because when you have a contraction where people can't have access for X amount of time, you're going to start, as people are starting to start traveling and getting back to their normal lives, we're going to start seeing increases in a little slight increase and bump into all these kind of threats and communicable diseases. So the good news is we're doing our best to be vigilant and surveillance and making sure that we communicate properly to our medical community, our nursing community, our hospital system, so that if there are any emerging threats, that we can communicate that directly. And I will say for the physicians out there, what's important if you're interested, we have these health alert networks that we will send out. So these, if you want to know of any emerging threats that both from the federal side, the CDC, and from the public health side have discovered that we want to communicate that message, we will send out these health alert networks, HANs that we call them, to the providers. So we have a way for y'all to sign up. So if you have an individual doctor that's interested in getting those alerts directly to their email, you can go to our webpage, tarrantcountytx.gov, and click on the Public Health Department webpage, and you can find a way to enroll yourself into the Health Alert Network. Or just contact the Medical Society, and then we'll get you connected that way too. But those are great ways to be connected and know right away if there's any health emerging threats coming out.
You're smooth with podcasts. You're very good.
He's good.
You're very good. No, you're eloquent. Get to the point. It's excellent. And hey, thank you for all you do.
Oh, thank you.
You are an unsung hero. I mean, you've dealt with a lot, and a lot of people are alive today because of your efforts, and we really are indebted to you and appreciate.
Well, I appreciate you guys. It's I say it's obviously not a one person fight. We're one team, one fight. So we're all in this together. Like I said, we couldn't have done this without you guys, and even our hospital partners and our other community partners. So we understand we're all in this together, and anything we can do to help you all, whether it's education, whether it's screening, whatever y'all need, we are here to help. So I encourage your listeners to call us if they have any questions, and we'll do what we can. We're here to help and serve.
And we'll put up a couple links right on our website, and I hope you guys are enjoying our podcast. We're trying to knock out, right, and have some interesting topics. And I hope this was informative to the public.
I learned a lot.
I did. I definitely did.
Yeah.
So. All right. Well, that's it for this podcast. You can follow us on YouTube, Spotify, Apple products. Please subscribe, and we'll see you on our next podcast. Thanks.
Thank you.